The second part of this conversation is about social media versus tools like UReport. And I would like to compare that to revolution versus evolution. So we know that whenever there is a revolution, there is bloodshed. And revolutions are usually event-oriented. And very often what happens is when the revolution is successful, the people who caused the revolution are so invested in the revolution itself that they forget why the revolution was done to begin with, right? You've seen Egypt, you've seen Libya, you have Syria. I mean, you take country after country, and social media played a large part in the uprising, which was called the Arab Spring, right? Social media played an important role. But the problem with that revolution is that the event happened and then it went back to, or became worse than what it was before. Why? Because there was no grounding factor, there was no policy, legislation, support group behind it that actually could sustain it. Yeah? But if you really want to have change happen and engagement happen, there has to be a dialogue. There has to be a continuous conversation. In social media, there's very little continuous conversation going on. There are lots of conversations happening, but not all leading to any purpose, in most cases. UReport, I'd call, or tools like UReport, I'd call like an evolutionary system, where there is a common dialogue. The conversation is about the interest of the people who are having that dialogue. And so we've seen that when you use UReport as a tool addressing citizens' issues and having a conversation about issues that are important to citizens, the response rate is very, very high. But the moment you make it a UNICEF propaganda machine, the response rate goes down, because unless they are connected to it. So in Uganda, there was this whole UReport survey on FGM, way before this survey, 76% response rate. Why? Because people felt that was an important issue that was being discussed. And then we had something on climate change, which was totally kind of, in perception, irrelevant to people on the ground. Response rate was 12%. Still very good compared to online response rates, but 12%. So you can see when it is relevant and about the people who are having that conversation, then the response rate and participation and engagement is good. So that's the difference between social media and UReport-like tools that I would like to bring. Use cases. You can actually use UReport to influence global conversations. So Rio conference was taking place, the climate conference, and the government of Uganda delegation included 2 UReporters as a part of the official delegation. And whatever was being discussed in the room, they were texting it back to Uganda, and it was being rebroadcast to all the UReporters. At that time, they were like 100,000 UReporters. And within 5 hours, 6 hours, you're getting 50,000 responses to that conversation, which we were then aggregating and sending back to Rio via text. And so when Uganda spoke, it spoke with detailed breakdown of what 50,000 people, boys, girls, this part, that part spoke or were saying. They became so influential that they were invited to join the drafting committee of the Rio communique. Yeah? So that's one use case. Another use case is influencing budgets and legislations. We often spend a lot of time in the Ministry of Finance or in the ministries trying to focus on budget allocations. But most of the decisions are actually made in the parliament, not in the ministry. And so the question is, with UReport, we have examples where supplementary defense funding budget was submitted. The parliament sent it back 3 times, saying, unless you add $30 million for immunization, we're not going to approve this. Why? Because UReporters in a survey had said that there is no vaccine and the shortages are there and we need more money so that the vaccines can be brought. So that's another use case. In a country, they started a youth fund, and this is an example of how policy change can be done. And there was a big fight happening. The government was saying, we've given the money as youth fund, you can take loans from it. And the young people were saying, we don't have access to it. And for 4 weeks, back and forth, newspaper fights going on. And then we did a survey on saying, what is it that stops you from accessing these funds? And 80% of the people responded saying, they are asking for an A-level certificate, 2 guarantors, and a bank account. If we had all this, why would we need this $25 loan from the government? We shared that data with the government. Within 5 days, the policy was changed. These 3 conditions were dropped, and the utilization of fund went up. In emergencies and crises, so banana is the 3rd largest export of Uganda, about $400–500 million a year. And suddenly the banana trees started getting yellow, the bananas were shrinking and falling down, and the Ministry of Agriculture wanted to do a survey that was going to take 4 months and $400,000 to establish, just to establish where the epidemic is. And World Bank came to us and said, could you help us map this? Within 12 hours, the U reporters mapped where the epidemic was in the country. We provided them information. They actually went and started training the farmers, and within 3 months, the epidemic was controlled. World Bank published a paper which says that U reporters in Uganda saved $329 million in export. You could actually ask a question about any topic and then analyze how the responses are different from different areas. And you can actually create a national story around that topic. And then, if you do an intervention, you could repeat that question after 3–4 months and see if that perception has changed or not, and that would give you an immediate idea of what's happening. Imagine a continuous rolling situation analysis which is actually generated by the people and not just by, I mean, we're talking about child-based organization. How many situation analysis or country programs have we done which have been written by children or by women or by the beneficiaries? It's all us and our consultants writing about what should be about women and children. I mean, who would know more about what they need than the people who are going to benefit from it?
So in follow-up from Kenya, I'm sharing Swaziland's example of the application of innovation to citizen engagement and social accountability. Swaziland, as already mentioned earlier today, is in the infancy stage. We're at the piloting stage of the U-Report initiative. It was only approved in November last year by Cabinet, and we spent a large amount of time jumping through hoops and massaging the right people from the Prime Minister to be able to get to Cabinet and have it approved at the highest level. So from November to date, this is what's been happening. The overview of the initiative, obviously we've heard various presentations that U-Report really engages communities on matters that affect them and provides timely feedback to decision makers and service providers for informed and appropriate action. In Swaziland, our primary focus has been on engaging adolescents and youth, and I'll talk about that later in the presentation. So in 2013, Swaziland office established the infrastructure for U-Report. In 2014, we updated to the rapid progress system. Yet, this still wasn't operationalised. It was thanks to the Gates initiative, which actually provided the springboard and the funding required to be able to recruit a technical team, and also for the subscription of Rapid Pro. And then, obviously, as already mentioned, in November 2015, we were endorsed at the highest level to utilise U-Reports in Swaziland. So our linkages are with government, from the Prime Minister's office being managed through the Deputy Prime Minister's office as the chair of the steering committee, working also with the Ministry of Health, Ministry of Education, and Nurture, which is the National Emergency Response Council to HIV and AIDS in Swaziland. We're working with civil society and private sector, which is MTN, the sole telecommunications server provider in Swaziland. The current reach, we're piloting in two out of the 4 regions in Swaziland, which is what was approved by government. And today, we've currently recruited 2,800 U-Reporters and increasing on a daily basis. of which 63% are females and 37% males, with the average age of 21 years old. We realise that the numbers are quite small at the moment, and we have a target of 100,000 enrolments by the end of 2016, and we have implementing plans which we're currently implementing at present. With the concerns that are being raised, UNICEF has actually partnered with NGO civil society that are using the concerns and trending issues in radio programs on a weekly basis. So these are being discussed nationally with key experts responding to the issues that are being raised. And just the last point, it really reduces, we're seeing time savings. So having your report really reduces the amount of time to be able to feedback and gather information and respond. So the main challenges we see is how to manage your reporters' expectations. We've heard it a number of times, maintaining active and positive participation when you're not seeing results. So that's one of the key challenges. Another one, which is more a little bit of a projection, but the question of how do you effectively engage adolescents and youth in planning and programming that affects them when sometimes the views are quite conservative. So I'm talking in the area of HIV and AIDS as well. And then, of course, already mentioned the timeliness, the length of time it requires to establish these systems with government and build capacity. The key achievements is that we're actually complementing the efforts made by nurturing partners to prevent new adolescent HIV infections. We've created an HIV dashboard to help understand emerging trends and issues.
So UNICEF role in this innovation was technical and financial assistance, initially to develop the idea and also to support the partner and adapting the Uganda model of the U report. To target young people to registration, so supporting campaigns in the media and also with other partners so that young people could be able to enroll. And the way for enrollment was just to send an SMS. There was a free toll number that had been created and it was free. You could just enroll into that number, and if you're a young person, you don't need to put any name, and immediately you become a U reporter in Zambia. And then the other area of UNICEF support was the monitoring and evaluation of the initiative. The support we were giving financially was about $25,000 US per quarter to the NGO partner whom we are partnering with. And through the advocacy from UNICEF, this has now been part of the Zambian support from the Global Fund. So UNICEF is no longer putting any money in this. From the National AIDS Council, they've already put it as one of their interventions, so it's being funded from the government appeal to the National AIDS, to the Global Fund. This is just a diagram to show you, a schematic diagram to show you how it works. The first step is the enrollment by sending an SMS to apply to be a U reporter and to the service providers who are indicated there. And then from there, as soon as you are registered as a U reporter, you can send an SMS to send any question, ask any question on whichever area. And if the question is generic, there is a knowledge bank, and the knowledge bank can immediately provide a response on that question on the area which the young person or the adolescent is asking about. If it is more specific, the question is referred to a group of counselors who will be able to reach out to the young individual, the adolescent or the youth, and to be able to provide more specific information. And then the third leg is the referral, to be able to provide more in-depth service to the U reporter on the issues they've been able to ask about. So there's an issue of generic knowledge bank and trying to develop what are some of the issues that are facing young people that can inform the program, but also being able to provide real-time response to the young person from whatever place they are in. And then referring them to a group of counselors who are housed within the civil society organization, and then also being able to participate in polling on some key issues to be able to gain the views of the young people.
From this level, we are doing a first manner of doing citizens engagement. We have defined our citizens at the moment as organized, advanced, village level in the form of community nutrition, food and nutrition security committees. We will move a little lower to individual communities. But for now, our citizens' engagement is at checking the plans that are developed at ward level and at village level, whether they are being implemented. Because our objective is to reduce stunting. So if there are actions that have been planned here and they have not happened, then it is possible that that information can reach up to national level, can be acted on at provincial level and at district level. That's the objective for the moment. Once we have sorted this out, we are intending to reach vulnerable households, vulnerable to malnutrition. Now, what can we say we were addressing? A policy that exists, structures that don't work, but our main objective was to make sure that data exists that supports sectors in terms of improving quality in the system, in the work that we were doing. What did we have to do as UNICEF to make sure that we could do a citizens engagement component and introduce social accountability for actions that have been promised? What we did was, since we had already introduced the real-time monitoring, it took us a bit of time to sell that. We spent time advocating for the citizens' feedback into the real-time monitoring that we are doing. So we spent time in advocating and then developing the system and integrating it with the other system, convincing the Food and Nutrition Council, which sits at the office of the President, that it was important to listen to citizens. They only know it's important to listen during elections, but we managed to say for nutrition it's also important. We supported reformulation of how the community meetings take place so that information from citizens could be used to cause actions.
You had mentioned that your average user was 21 years in Swaziland, and then you were also facing the challenge of the younger groups. Did you do a feasibility of how many of those young adolescent girls had access to cell phones or ability to use technology through other family members before you initiated this? And because, again, for stunting, adolescent girls are also a challenge for us, but we'd like to know, how did you engage them earlier on in understanding whether or not your approach would actually reach those younger adolescent groups?
So the question is, what is the tool that you are using for engaging youth as a strategy cutting across all programs? This is one of the tools. There might be other ways of engaging young people, and you're very welcome to use that, but look at youth engagement as a cross-cutting strategy for everything that we do, because that's 60% of the population in the countries that you work. And this happens to one tool, which is available, which is used extensively. But also, imagine, we right now not done any promotions for your report. With Android, iOS, and NatComs taking on, we are looking at 40, 50 million, 60 million young people all over the world. Imagine talking about an issue and then bringing about not only change in the country, but also global change.
At the moment, we have quite a staggered or staged approach with the implementation of your report, and our primary focus is actually the AIDS initiative, so establishing your report within the health system. We have key tracer indicators that we're monitoring, and those indicators also feed into the ESARO and global priorities. And so we're focusing on that aspect, but we haven't actually started implementing your report with the end user to obtain that client satisfaction survey and get that feedback loop as of yet. So the only reporting that we've done is in relation to, at the moment, just polling and the unsolicited responses. But we do have, or our plan is to phase it out in health, education, child protection, as priority, as the government also prioritizes. And then we'll be able to demonstrate the results.
Our group decided, I think the conversation that especially you talked about the youth, And I think it has ability to target and campaign specific issues, and we're able to reach certain demographic groups that have the tools and the ability to communicate with us so we can get feedback. That's one thing that we thought it would work. It can also be used, we can actually use it for different programming. For example, in P40, in our campaigns, in different areas, we can actually specifically use it for a specific programmatic need, which is really great. And it's participatory. It helps us to look at, we can analyze using what people are saying to us, but we can also collect certain information to strengthen the things we're already using, and we gave examples of the DHIS and HMIS and IMIS, and all those things. We can actually use it as a pulse to test where we are in certain places, in certain programming aspects, and I think that's really a good thing for us. We can use it to get information both on our programmatic and on certain issue we want to engage certain groups. Now, what does UNICEF need to do to take citizen engagement to scale it up? I think we need to take the U-Report toolkit a little bit further. I think we need to make it available, and I think in our group, because we have people who are working in this specific, they said, no, we have U-Report toolkit, it's available, there is a guidance, there is a plan, there is a strategy to roll it out. So I think we are already sort of doing that, but we need to do more. We need to make it a little bit of a global platform to say, if you want to take it further, we need to take it to the scale. But these are the criteria and these are the guidances you need to follow. It's not just open for everyone. There are specific things you need to comply with it.
From the discourse from Uganda, with regards to what is working in terms of citizen engagement systems, what we need to do in terms of scale up, and how to address issues of sustainability. So one thing that the team appreciated is the fact that a number of traditional systems already exist, and what the community of citizen engagement systems is doing is to enable us enhance the effectiveness of our interaction, so that at least we are able to get to target or tailor the discussions and inform the interactions therein. So we are appreciating the placement of technology, and that more or less summarizes why the citizen engagement systems are really useful. Now, again, we also appreciate the fact that with respect to more strengthened or more evidence programming by government and other duty bearers, and the fact that there is more accountability demand by the development partner community, we need to be able to have a better platform for providing feedback, so that at least the design of interventions is guided by the participants of the community, and that is the placement of the citizen engagement. Again, the fact that, yes, we can use statistics, the quantitative statistics that are available from the routine health information system, but the need to have triangulation of information requires us to have some more qualitative information in nature, and that can only be able to be pulled out when we have this kind of discourse, so that at least we are able to drill down and find out some of the issues explaining the circumstances that we will be seeing from the statistics. So the qualitative component that comes from the citizen expression is so key.
Encouraging community dialogues. So while you have the platform to actually send questions in one-on-one, the group really spoke quite a bit about how community dialogues and actually having qualitative discussions and particularly then moderating those discussions. So not just having the discussions, but trying to find a way of how UNICEF could facilitate and actually help moderate the discussions. There was also quite a bit of discussions about the under the tree dialogues, and we were talking of how these could potentially spiral into perhaps E3s for children or something in that fashion, that we can actually moderate and link those to results that we're looking at. For the second question, which is about what we should do, once again the group discussed quite a bit about first understanding. So if we have to go in for these moderated discussions and qualitative community dialogues and understanding issues and actions, it's important for us to have a full understanding of what's already happening in a particular country context. So how do we define and map out areas of interest? How do we identify the risks and opportunities? And then how do we then go forward to develop criteria and guidance for engagement? I think several members of the group felt we don't have to necessarily do it all. There's already a lot of platforms existing, and how do we maximize those platforms? There was also the other aspect of ensuring access to mobile connectivity. And I think the group spoke quite a bit about most how to reach, and we've been speaking about that. But the interesting part was, you don't program by trying to assume that people don't have phones or that we're not there yet. But instead, how do we turn it around and program in such a way, thinking of the future, and actually facilitating and programming in such a way that people will get the phones and will have data and will be able to access and connect in the near future.
We have Eddie and Tim, who will be presenting on behalf of the Secretariat. They're going to take us back to this morning when we started our day and we had a recap of yesterday's discussions and some of the ideas that came from yesterday. And they're going to continue the journey and share with us what it is that we have come up with in the course of this morning and this afternoon, and a number of recommendations at various levels of the organization for all of us and for other colleagues that we will be sharing the report and the outcomes of this meeting with. Once colleagues have shared with us the quick summary of the recap, we'll open up to any clarifications and any issues briefly, and then I would hand over to Omar for some concluding remarks as we wrap up. So Eddie and Tim, over to you.